Communicating at end of life. Soldiers Home Holyoke nurses have identified that communication with families and caregivers can be a challenge for nurses in end-of-life care. Social worker Bob Malikan has many years of experience in this type of communication. In the following video, Bob offers some valuable insights he has gained throughout the years.
You enter that room and there's all this weight behind you. I need to come out the other side with the blood pressure, with the this, with the that. So you come in there with your own agenda, which may not be the patient's agenda. And being able to put yourself in somebody else's shoes and feel what they're feeling and seeing it from their perspective. You have the veteran who doesn't want to be here. You have the wife who's feeling guilty. You have families that are very together, very wonderful, very supportive. So you don't know what you're going to be entering when you go into that room. And every time you're dealing with a death, of course, you think about all the losses we've had in our own lives. But you need to, you think about it, but then you have to put it aside. Eye contact is important. Positioning is very important. And touch is important too. Pacing is so important. Not moving too fast, not making assumptions about anything, but kind of seeing yourself as somebody who's entering a foreign land and we don't really understand it. And we need to first have an understanding of who we're working with before we start going in with our skills. You look first to the veteran and speak to him or her, and then you go to the family. I introduce myself, say this must be a very difficult time for everybody, but we're here to try to make things as comfortable as possible. And our job is to provide them with the comfort and care and respect and dignity so they can still have quality of life. Define your role a little bit as far as being a support person and really answering any questions they might have. Maybe it just can be a bedside chat, but reframing what hospice is. We're providing end-of-life care in a comfortable way and trying to give people a quality of life. So that's a key nursing piece. Nursing, I think, needs to re-educate families about what hospice is. A lot of times people don't really understand it completely. Explaining the role of morphine, explaining the role of sleeping medications, and also be able to explain about why people aren't eating, why they're, should we be forcing them to drink fluids, all those things. So that's a key nursing role. If I'm in the room and the person dies, I leave at that moment. That's such a personal, private moment that there's no place for me. And then I'll go back 10, 15 minutes later, sort of want to make sure everything's okay. But we've all felt anger from families too, but it might not really be about us. We don't really know what that's going on. We just can't personalize all these things. Pull the family aside and say, I feel like there's something going on with us here, and I don't understand it. We're here to help you as much as possible. We want to be a team together. And at the same time, acknowledging that this is a very stressful time for you. I understand that. First of all, I always emphasize to people that they're not doing nothing. Their presence is so very important. We never know what people are hearing. Even if they might not be able to respond to you or request to squeeze their hand or to talk to you, people sometimes can hear what's going on. So you want to validate what it is they're actually doing. Their presence is important. I'll sometimes take people's hands and say, if you want to put it on his chest, that sometimes can be a comforting piece also. They can feel the heartbeat, the veteran possibly can feel the hand, or I'll have them hold the hand underneath the cover, those kinds of things. And then I'll validate what it is they're going through. But I think there needs to be a response to certain kinds of questions. I always go to, I don't know what it's like, it must be very difficult, can you tell me more? Or what's your understanding of what's happening? I always want to put it back on them. We just want to make sure that when the end comes that he's comfortable. And then I'll say, that's what we all want. So I put it in terms of hoping for the best and planning for the worst.
Here are some important take-home points from the video. Always address the veteran first, even if he or she is unresponsive. This lets families know that you care for and respect their loved one. When possible, communicate at eye level and take some time to really listen, even if you have only a couple of moments. Validate families' concerns and remind them that their presence is valuable. People are bound to become upset and emotional around death. Try not to take it personally and take some time away if you need to. It's okay to step out of the room. If a veteran passes away on your unit, leave the room. Come back in 10 or 15 minutes to check in. Remember that communication is key. Listen, ask, and explain carefully and mindfully. Families need time, space, privacy, and compassion. They need you. Occasionally, interactions on the Comfort Care unit can be emotionally charged. If you need help navigating a social situation with a veteran or family members, Bob Malikin, the facility social worker, is a fantastic resource and is available for consult on weekdays from 8 to 5. Brother Frank in the chapel is another great resource. Again, if you have a problem you cannot solve, do not hesitate to contact hospice services.